Hi, good afternoon. My name is Dr. Jedisai, and I'm here to enlighten you on, with my patients with type 2 diabetes, the important numbers you need to know, and how we and Dr. Ross can help you to minimize, or in many cases, eliminate any diabetic eye complications. I'm sure the majority of you know diabetes can increase the risk of bleeding in the retina, the back of the eye, called retinopathy. Diabetes can also increase the risk of cataracts, in which when the lens that focuses the image on how we see gets a little cloudy, it makes it a little difficult to see up close, and eventually make it a little difficult to see far away. Now, for my 12 plus years of experience as an optometrist, I'll have patients come and go, "Oh, good afternoon, Mr. Smith. I'm here to help you, and I notice you have type 2 diabetes." "Well, that's right, Doc. I have for 5 years." They go, "Well, Mr. Smith, how's your blood sugar reading?" "Oh, I prick myself in the morning, and every morning it's about 130, 120. I go, "Great. So, we'll do the dilation, a look at the retina. We'll take a photo of the retina." You go, "Well, see, Mr. Smith, I'm a little concerned about your eye health and your health in overall. I'm noticing right here, here, and here, you got capillaries of bleeding from diabetes. Don't worry, it's not blurring your vision, but it's a concern." "Well, Doctor, sorry, I don't understand. My blood sugar in the morning is fine. Why am I seeing blurry and getting a retinal bleeding?" Well, I go, "Mr. Smith, do you measure your blood sugar after you eat, 90 minutes after you eat? Do you know what your A1C reading is?" "Well, I don't really know, Doc. That seems like a foreign language to me, but, well, the A1C is a test that your medical doctor will do every 3 months. It measures how much sugar is bound to your red blood cells, and the numbers are such that if your A1C is under 6.0, that's great. You don't have any diabetes. If it's 6.0 to 6.4, it puts you a little bit at the borderline called prediabetes. Above 6.5, and it's definitely diabetes. And sadly, if your A1C is above 7.0, you're going to increase the risk of complications of diabetes, both from cataracts and bleeding in the retina. Secondly, it's important to measure your blood sugar hour and a half after you eat, and write a food log of what you eat. Because certain foods, if they make your blood sugar spike, that's actually toxic and can increase the risk of bleeding in the eye. So with the food log, it gives you an idea what food groups to eliminate or avoid. Thirdly, as part of your knowledge, as we do on every patient in our office here, is we'll do a blood pressure test. Barb, Robin, Fatima, Sue, we always get the blood pressure reading and write it down. And the reason why it's important with diabetes is there's a certain complication in the retina called macular edema. The macula helps us to see fine details far away and when we read, and helps us see beautiful faces and ugly faces like yours truly. But if you have high blood pressure and your capillaries in your retina are squeezing out fluid, and you got swelling called macular edema, everything will start to be suddenly blurry. And many times you would need a laser treatment by a retina specialist to clear out the fluid. And with hypertension, your physician will need to control your blood pressure. So of course, at the end of the results, you get a report. We'll write down your blood pressure. We'll do your retinal imaging, and with a little report of any bleeding. And second test is after we screen you for cataracts and diabetes, we also need to make sure your refraction or your prescription is stable. Because if your blood sugar goes up and down, your vision can't see clear, and it's blurry. And it's important to keep everything stable to avoid any sudden vision blur from prescription change. So we'll communicate with your physician if your blood sugar is unstable, and we can see you to refract you until everything is stable. And now you ask me, oh, Dr. Desai, thank you for your wonderful information, but what can I do to help minimize my blood sugar spike? Well, good question. Number one, I encourage everybody to see a dietitian. A dietitian is just as important as your eye doctor, your dentist, your physician, your podiatrist, and when they manage diabetic complications on all of your body structures. Dietitians are scientifically educated in human biochemistry on how different nutrition, foods affects your biochemistry and which is healthy, beneficial, which is toxic. By looking at your blood sugar, A1C readings by your physician, they can devise a great meal plan on portion control, which foods to avoid, which foods is safe to eat without any restrictions. And I've seen results that their blood sugar goes down, they lose the weight, their bleeding in the retina goes away, and I've seen it happen hundreds of times. It's also just as important is to exercise, because by shrinking the belly fat, it's going to help the insulin work better to take sugar from your blood and inject it to the cells to function. Because having a big belly is going to interfere with how insulin works. Now I encourage you, before you start hitting the gym, please talk to your physician first, make sure it's safe medically. Once it's safe, I'd recommend you see a personal trainer who's certified and who has experience training patients with diabetes to lose weight, slim down. And it's amazing, once they start slimming down, their blood sugar will go steady and there will be less spiking, less cataracts, less retinal bleeding complications. And a few suggestions in order to speed up your metabolism. When I speak to many patients, is it exercise? I say, well, yeah, walk around the block, few laps, about 20 minutes. Unfortunately, that doesn't cut it. You need to build up a sweat. A few suggestions. If you like to run or use a treadmill in the blah winter time, I increase the speed interval. So you're running or jogging at a moderate pace, then speed up. So you're running really fast for a few minutes, build up a sweat until you have a hard time speaking. And then once you start to go back to normal pace, pick up the speed, and I guarantee you after half an hour you'll feel much better. I also recommend that another way to do it is either running up the hills in the nice day or in the winter, vary the incline of your treadmill. And what I recommend, start at a normal jogging running pace with a mild incline, gradually build up the incline like you're walking up a hill on San Francisco and slow down the pace. So you go like this and don't hold in the handrails, just use your arms, and that's a great way to increase the heart rate to speed up your metabolism. And from my experience with many patients who took good care, they actually have reduced or many times eliminated any diabetic complications. So thank you.